Bismillahirrahmanirrahim. Today we will have case quiz number 13. Case data: 47 years old female, evaluated in the emergency department for sharp mid-chest pain that developed abruptly. Mid-chest pain developed abruptly, so sudden onset of mid-chest pain necessitating emergency admission. The pain is exacerbated by lying down, deep inspiration, or coughing, but improves when she sits up. Physical examination showed temperature is slightly elevated, 37.8 degrees centigrade. Blood pressure is somewhat high, 140/88, but not exceeding the upper limit of normal. Pulse rate tachycardia with 100 beats per minute. Respiratory rate tachypnea with 22 cycles per minute. A friction rub at the left sternal border is heard, but the lungs are clear. Musculoskeletal examination showed there are swelling and tenderness of the second and third proximal interphalangeal joints and metacarpophalangeal joints. Investigations: ESR high 56, CRP high 24, rheumatoid factor negative, ANA negative. ECG showed diffuse ST segment elevations in all leads except AVR and V1, and BR segment depression in the leads V2 to V6. So, which of the following is the most likely cause of this patient's pericarditis? So the case is pericarditis for sure. We are not asking about the condition. The condition here is pericarditis. But what is the cause of this pericarditis? Is it ankylosing spondylitis, polymyalgia rheumatica, psoriatic arthritis, or rheumatoid arthritis? Ankylosing spondylitis or axial SpA, polymyalgia rheumatica, psoriatic arthritis, or rheumatoid arthritis. Which of the following four conditions caused pericarditis? Yes, the answer is rheumatoid arthritis. Educational objective of this case is to identify rheumatoid arthritis as a cause of pericarditis, which in fact we are as rheumatologists may forget or ignore other extra articular manifestations, especially if are not so common. We cannot ignore renal, for example, and systemic lupus because renal complication is so common. But pericarditis or cardiac problems of rheumatoid, we may not be aware of it unless in severe cases or unless diagnosed by cardiologist. Discussion: pericarditis is the most common cardiac manifestation of rheumatoid arthritis and is often asymptomatic. Rheumatoid arthritis is the most likely cause of this patient's pericarditis. Rheumatoid arthritis is an independent risk factor for both coronary artery disease and heart failure. Patients with severe extra-articular disease are at particular increased risk of cardiovascular death. We mean by independent risk factor that rheumatoid arthritis per se is a risk factor for cardiac complications. We don't need hypertension or diabetes or old age and so on to increase the risk for cardiovascular complications. Rheumatoid alone can cause these complications. Pericarditis is the most common cardiac manifestation of RA, as we see, as I said before, Approximately one-third of patients with rheumatoid arthritis can be found to have an asymptomatic pericardial effusion. About one-third, so it is very common among rheumatoid patients, but mainly asymptomatic. 10% of patients with rheumatoid arthritis will have symptomatic pericarditis at some point during the course of their disease, but it is usually in the most of cases mild to moderate and not necessitating hospital admission. Most of these with symptomatic disease have a positive rheumatoid factor and active synovitis. However, when symptomatic, the manifestations are likely to be similar to those of any other cause of pericarditis. Diagnosis is most often made by confirming two of three classic findings: chest pain, often with a pleuritic component, friction rub, and diffuse ST segment elevation on ECG. Now, what about the other differentials of this case in the question? Ankylosing spondylitis is a form of spondyloarthritis that manifests primarily by axial inflammation and bony ankylosis. However, inflammatory arthritis involvement of the hands tend to present as sausage digit rather than symmetric polyarthritis seen in rheumatoid arthritis. Although conduction defect and aortitis with dilatation of the aortic valve rings and aortic regurgitation occur, pericarditis is not seen in patients with ankylosing spondylitis. So the cardiac or cardiovascular complications of ankylosing are different from pericarditis. The second differential is polymyalgia rheumatica. However, polymyalgia rheumatica occurs in patients over the age of 50 years and causes diffuse achiness at the neck, shoulder girdle, and pelvic girdle. It is rarely associated with synovitis and is not associated with pericarditis. Psoriatic arthritis is associated with increased risk of coronary artery disease, as in RA. It can also cause asymmetric polyarticular inflammatory arthritis involving the small joints of the hands. However, psoriatic arthritis is not a common cause of pericarditis. So, psoriatic arthritis may be complicated with pericarditis, but it is not common. But polymyalgia rheumatica and ankylosing are not associated with pericarditis, so the answer is rheumatoid arthritis. And finally, thank you very much for your attendance, and we will meet you in the next future with case quiz number 14. Wassalamu alaikum wa rahmatullahi wa barakatuh.